When I was a doctor in the system, my medical license gave me two supposed privileges. One of them was the ability to prescribe pharmaceuticals, and the other was the ability to order tests. After realizing the nature of allopathy, I was quite happy to throw away the prescription pad and retire from the drug dealing. But what about tests, and in particular, screening tests? These purportedly have the ability to detect disease, including serious ones such as cancer. I once thought that screening tests were the responsible thing to do for both myself and my patients. However, my own personal experiences with them and becoming aware of the wider medical fraud in 2020 resulted in a paradigm shift. In this video, I'll outline what you need to know about screening tests and whether they have any role in improving your health. Working with terrain is tricky because it changes continually. Various diagnostics give you a snapshot of the terrain. Trouble is, that snapshot may be out of the southeast corner rather than a satellite view. Dr. Harvey Biggleson, holographic blood. During one of my pregnancies, I was asked to do some, quote, routine tests. According to the health practitioners, one of the tests indicated that I probably had gestational diabetes. We almost fell over laughing, but the attending staff did not see what was funny about it and said that my baby was at high risk of complications. I did not agree to any of their interventions. Next, I was informed that I had a significant thyroid disorder, but again, I did not agree to any further interventions. I was sent an alarming letter, and a doctor even called me to plead that I attend the hospital for follow-up, which I politely declined. My pregnancy health remained fine, and my baby was perfect in every way at birth. The only regret I had was agreeing to do any of the screening tests in the first place. What is a screening test? Wikipedia informs us that in medicine, screening is a strategy used to look for as yet unrecognized conditions or risk markers. This testing can be applied to individuals or to a whole population without symptoms or signs of the disease being screened. While this video will concentrate on screening tests, many of the principles apply to medical tests in general. There will be some overlap in my examples as many tests are used in both settings. When I was trained as a doctor, the issue of screening tests and even national screening programs was a hot topic. Typically, a particular investigation was championed by a subsection of the medical profession. For example, mammograms by radiology facilities or colonoscopies by gastroenterology clinics. Naturally, these groups have vested interests, and getting entire populations onto the books was a very lucrative business. However, others in the medical sector would protest that the, quote, investment had relatively poor returns and the flow of funds should be directed into other pet projects. The most honest researchers within the mainstream paradigm will call out entire screening programs as not only poor investments, but also harmful. They point out that concentrating on one metric, such as the mortality rate, is disingenuous when it ignores the damage caused by unnecessary tests, medical interventions, and anxiety-induced health complications. For example, in 2013, Dr. Peter Gotche for the Cochrane collaboration analysed randomised trials comparing mammographic screening with no mammographic screening. His conclusion shocked many in the establishment, and he wrote, "For every 2,000 women invited for screening throughout 10 years, one will avoid dying of breast cancer, and 10 healthy women who would not have been diagnosed if there had not been screening will be treated unnecessarily. Furthermore, more than 200 women will experience important psychological distress, including anxiety and uncertainty for years because of false positive findings." However, going beyond the allopathic or mainstream paradigm, alleged screening tests can be even more dangerous. This includes any test that purportedly screens for a virus. When the virus itself has not been shown to exist, Clearly, the premise behind such a test evaporates into pseudoscience. We do need to be cautious, though, about categorically ruling out such a test as completely meaningless, even if there is no evidence for a virus. It may be that the test has detected an inflammatory response or healing attempt by the body. For example, there is no evidence for the existence of HIV as an infectious and disease-causing virus. Clearly, the virologists do not find an entity that meets the definition of a virus in the blood of people who are alleged to be infected. If you are not familiar with this issue, then you can watch my video series of the Perth group's The Yin and Yang of HIV. Our book Virus Mania also covers the issue in detail, and the Perth group's HIV, A Virus Like No Other, is the most comprehensive treatise in the field. But if there is no virus, how does the HIV screening test work? Well, an HIV antibody test does not require the existence of a virus. This is a widely underappreciated fact, but even on its own terms, the establishment model admits to the problem out in the open. For example, the website AIDSmap has a page titled False Positive Results on HIV Tests. At the start, it is stated that tests always produce a small number of false positive results. Subsequently, we are informed that Australia has a 0.1% prevalence of HIV. So if the HIV antibody test is applied to the Australian population, only 16.6% of the positives would have a, quote, true HIV infection. In other words, more than 83%, or the significant majority, do not have a, quote, HIV infection despite the positive test. These probabilities are on their own terms, of course, and the whole thing is like trying to orientate yourself on a Mobius strip. They do not have a real gold standard, and both the 0.1% prevalence figure in Australia and the screening test's, quote, true HIV infection rate are also based on laboratory assays rather than actually finding a virus. Contrast that to a pregnancy test where the gold standard is seeing the baby. In the real world, baby found. HIV, not found. There are dozens of conditions associated with positive HIV tests, although the AIDSmap page neglects to mention these. Interestingly, the article does admit that false positive results may occur in people who have recently had a vaccination. This is an issue we have covered before, including an Australian COVID-19 vaccine candidate that resulted in all of the recipients developing positive HIV test results. They were quickly declared as false positives, and the volunteers were assured they did not have HIV. But under the system of immunology and antibodies, were the recipients then said to be immune to HIV? Indeed, was it the accidental invention of the long-promised HIV vaccine? Alas, no. They had an excuse for that as well, and you can watch my video, COVID-19 Shots, Cancer and HIV, to see how that embarrassing episode was swept under the rug. This is just the tip of the iceberg when it comes to the serious problems with screening tests, even when you accept the premises of the mainstream or allopathic paradigm. The whole thing looks far worse when one is cognizant of the fallacies of that disease model and its supposed foundations. Outside of the lack of evidence for viruses, there is also the problem of attempting to use tests to say something about someone's health. The height of absurdity was during the COVID show when millions lined up to be tested. In August 2020, the WHO published its case definition for COVID-19. It stated that a confirmed case was a person with laboratory confirmation of COVID-19 infection, irrespective of clinical signs and symptoms. Laboratory confirmation typically refers to either the PCR or a lateral flow test. The former simply amplifies selected short genetic sequences, while the latter detects proteins. Both the genetic sequences and the proteins are claimed to come from a virus, something that has not been scientifically demonstrated. We have many presentations about this issue, and A Farewell to Virology by my husband Mark is a comprehensive treatise on the topic. In any case, even for the virus believers, the COVID-19 PCR and lateral flow tests were not validated to diagnose a disease state or give us any useful information about the health of the person. The mockery was out in the open, as the WHO had stated that a positive result from one of these molecular tests confirmed the COVID-19 diagnosis, quote, irrespective of clinical signs and symptoms. In other words, a case could have no symptoms, no signs, and no evidence of dis-ease. And yet, according to the WHO, they had a disease. What was previously known as being well was now called COVID-19. And if they did have symptoms, what was previously known as a cold, a flu, or the sniffles was now called COVID-19. You'd have thought that more people would have ignored such nonsense, but unfortunately the participants turn up when subsidised tests and free money is on offer. Here in New Zealand, you could get paid to take a week off if you were said to be a COVID-19 case. It incentivised buy-in for the fake pandemic, as people took dozens of lateral flow tests in the hope that at least one would contain their desired prize. 'Cause I've got a golden ticket. I've got a golden ticket. Unfortunately, people have been conditioned to want to be tested for sickness, whether it is real or not. This brings us into a higher level consideration of tests and how they fit into someone's perception of health. There are multiple elements to this, and it is beyond the scope of this video to address the contributing social, psychological, and political economy factors. We cover many of these things in our other publications, including our regular question and answer sessions. Suffice to say here, there are incentives, perverse as they may be, for mainstream doctors to make a diagnosis and for a patient to accept such a label. It is a dangerous game that requires a distorted view of nature, and more often than not, it leads to worse outcomes. There is a caveat here, and that is to say that there are some legitimate tests, but these are invariably outside the screening paradigm. For example, victims of severe trauma may need various medical investigations to establish the extent of the injuries and to guide surgeons on their required interventions. Another example would be an unconscious and compromised person brought into the emergency room. The attending physician may be guided by the results of the blood tests, and in the case of, say, hypoglycemia or low blood sugar, directed to the administration of treatment such as glucose. However, such instances make up the minority of what the medical system typically deals with. For the rest, it relies on a belief that a test or combinations of them can lead to a specific diagnosis being made, whether it is COVID-19, HIV, Lyme disease, rheumatoid arthritis, or hepatitis. While the tests may detect something, at most they indicate a reaction by the body and should not be used to pinpoint someone's health status. Unfortunately, medical tests are used like fishing nets, and the industry doesn't care what they catch, as long as it is something. The problem with the approach is that the labels are then used to direct treatment protocols, usually in the form of more tests, pharmaceuticals, and sometimes surgery. If the person is not unwell, then these kind of interventions are pointless and can only be damaging. On the other hand, if the person is unwell, giving them such a label does not address why they got into the state in the first place. The allopathic approach is to treat the test rather than the person. It suppresses symptoms and cuts out parts of the body rather than engage in the pursuit of true health and cure. So while I once had faith in tests when I worked as an allopathic physician, I no longer see the same utility in them. Nature's laws are the same for everyone, and good health comes from obeying those laws. The act of getting some tests done every few years contributes precisely nothing to your health. Ironically, the only good that could come from it is some psychological revenue or placebo effect if the person mistakenly believes that the activity does have benefits. Then of course we have the all too common scenario where individuals with unhealthy lifestyles return, quote, normal tests and are sent on their merry way with a misleading warrant of fitness. No matter who is being tested, It is a false paradigm where the participants feel they are being responsible and even heading off potential problems. Both the doctor and the patient focus on the test result rather than real health measures, an approach that ultimately leads to their downfall. The good news is that there is a much better way to be, and it is there for the taking. Health results from the daily decisions we make. Physically, it involves how much and what kind of foods we eat, our water sources, exercise levels, and exposure to personal and environmental toxins. Psychologically, it involves how we think, because physical manifestations can result from our thoughts. Spiritually, it involves our connection to God and sense of purpose in life. Nourishing all these fields brings about glorious health. It has been almost 5 years since our youngest child was born, and he has never had a lab test in his whole life. No one else in our household has had any medical tests over that period either. Our health is the best it has ever been because our focus is on all the decisions we make day to day with regard to the way our family lives. Careful attention to these matters is what makes us thrive rather than taking tests that funnel customers into the medico-pharmaceutical industry. For more information, you can browse all of the free resources at drsambailey.com. You also have the option of becoming a member of Dr. Sam's community for just $5 a month to access even more material. This includes our regular question and answer sessions where Mark and I often discuss the truth about dozens of medical tests. If you enjoyed this video, please visit supportdrsam.com.